All right, let's jump right into a topic that's absolutely crucial for both your exams and your future clinical practice: the principles of immunization. My goal here is to make this stuff super clear so you can walk away feeling confident about it.
So, live versus killed, active versus passive. Ever wondered why you can give some vaccines together but not others? Yeah, if that's ever tripped you up, you are definitely not alone. But don't worry, by the end of this, we're going to clear all that confusion up. Let's get into it. Okay, first things first, we've got to build a solid foundation. Let's start with the absolute core concepts of immunity, because honestly, everything else hinges on this. So let's talk active versus passive immunity. Think of it like this. Active immunity is like your body going to the gym. You're exposed to something, either the actual infection or a vaccine, and your body does the work. It builds its own muscles, its own antibodies, and it creates a long-lasting memory. It's strong, and it's yours. Now, passive immunity, that's like getting a bodyguard. You're given preformed antibodies, maybe from your mother to you as a baby. It gives you protection right away, which is great, but it's temporary. The bodyguard doesn't stick around forever. Okay, so keeping that in mind, what's immunization? Well, it's the big umbrella term. It covers any process that makes you immune, whether that's actively, like through a vaccine, or passively, by getting those ready-made antibodies. And vaccination? That's a bit more specific. It's the actual act of giving a vaccine. It's the method we use to trigger that active immune response we just talked about, getting your body trained and ready for the real thing. And this leads us to a really important idea: herd immunity. You've probably heard this term a lot. It's simple, really. When enough people in a community are immune, the disease just can't find new people to infect. It's like building a firewall. This protects the most vulnerable among us, the newborns, the people with weakened immune systems who can't get vaccinated themselves. It's a huge deal in public health. So, how exactly do vaccines pull this off? Well, it's all about priming the immune system. It's about giving it a memory of the enemy. This right here, this is the whole game. This explains exactly why vaccines are so effective. Look at the primary response, the first time your body sees a new bug. It's kind of slow, right? Takes 5 to 14 days to mount a defense. You get some IgM antibodies. They're like the first responders on the scene, but they're not the heavy hitters. But the most important thing that happens, your body creates memory cells. Now check out the secondary response. This is when your body sees that same bug again. Because of those memory cells, the response is lightning fast. We're talking 2 to 4 days. And this time, you get a huge flood of high-level IgG antibodies. These are the special forces, the long-term protectors. The entire goal of vaccination is to skip that slow, risky first fight and go straight to this powerful, rapid secondary response when you encounter the real pathogen. Now, you gotta know that not all vaccines are created equal. They use different strategies to train our immune system, and these differences have some really important clinical implications. Let's break down this arsenal against disease. Okay, this is a classic high-yield comparison for your exams: live versus killed vaccines. Live attenuated vaccines use a weakened but still living version of the bug. This gives your body a really good workout, mimicking a natural infection. So you get a powerful response, both humoral immunity, which is your antibody response, and cellular immunity, where your T cells get involved. Now, killed or inactivated vaccines, they use a dead bug. The response is still good, but it's mainly just humoral, and it's generally weaker. That's why you often need multiple booster shots. And here's the absolute key takeaway you can't forget. Because live vaccines are, well, live, you generally do not give them to patients with weakened immune systems. That's a huge contraindication. All right, pay close attention to this one because it's super high yield. We're talking about subunit vaccines, specifically polysaccharide versus conjugate. So some bacteria are tricky. They have this sugary outer coat, a polysaccharide capsule, that helps them hide from the immune system. A pure polysaccharide vaccine just uses this sugary coat. The problem? It triggers a T-cell independent response. What does that mean? It means you get a pretty weak response, mostly IgM, and here's the critical part: it just doesn't work well in kids under 2 years old. Their immune systems can't handle it. So what was the brilliant solution? Conjugate vaccines. Scientists took that same sugary polysaccharide and linked it or conjugated it to a carrier protein. This little trick turns the whole thing into a T-cell dependent response, and boom, now you get a strong, high-level IgG response with good memory, and most importantly, it's effective even in tiny infants. This is a game changer and a favorite exam question. Okay, we've got the how and the why down. Now let's get practical. Let's talk about the key clinical principles, the actual rules of vaccination you'll use every day. So how you give the vaccine matters a lot. Take a look at the different routes here. Intramuscular, or IM, goes straight in at a 90-degree angle. Subcutaneous is a bit shallower at 45 degrees. And then you have intradermal, which is just under the skin at a very shallow 10 to 15-degree angle. Think of the BCG vaccine. Getting the right route and angle is absolutely essential for making sure the vaccine gets to the right tissue layer to trigger the best possible immune response.
All right, these are the golden rules of vaccination. You absolutely need to know these for your exams. Rule number 1, if you're giving 2 different live vaccines, say MMR and varicella, and you don't give them on the exact same day, you must wait at least 4 weeks between them. That's non-negotiable. Rule 2, you can mix and match live and inactivated vaccines however you want. There's no minimum interval there. Rule 3, giving multiple shots at the same time? No problem, just make sure you use different sites, at least an inch apart. And finally, let's nail down the contraindications. You don't vaccinate if there's a history of a severe allergic reaction to a prior dose, if the child is moderately or severely ill right now, and, we've said it before, but it's that important, live vaccines are generally a no-go for anyone who is immunocompromised.
Okay, I know that was a lot to take in, so let's wrap this up by boiling it all down into a high-yield recap. These are the points you absolutely have to remember for your exams.
So here it is, the final takeaway. Number 1, active immunity, your body makes it. Passive immunity, you're given it. Simple. 2, that secondary and amnestic response is the whole point of vaccination. It's faster and way stronger. 3, live vaccines like MMR and OPV are a big no in immunocompromised patients. 4, remember the kids under 2. Conjugate vaccines work for them. Pure polysaccharide vaccines don't. And finally, number 5, always, always, always keep that 4-week gap between 2 different live vaccines if they're not given on the same day. If you can lock these 5 points down, you are in great shape.